I want to officially welcome everyone to today's episode of the CSA Revolution series. The focus today is risk-based approach and FMEA. Are they one and the same? We have a really solid panelist that's going to talk and have riveting discussions around today's topic. Quick introductions to today's astute panelists. We'll go left to right. So first we have a Nick, Senior Principal Quality Systems Specialist, Global IT Quality and Compliance Management from Medtronic. He's got over 16 years of experience in quality system regulation and CSV. Nick, welcome to today's webinar.
Nice meeting everyone.
Next we have Ron. Ron is a regular on our CSA Netflix show. Ron, welcome back from Johnson & Johnson. He is the Senior Director of Quality, responsible for computerized system validation within business applications, within the medical device arena. Background is consumer, pharmaceutical segments worldwide. His specialties are ERP, warehouse management, manufacturing, laboratory, on and on and on. So Ron has a lot of years of experience, and I'm sure he's going to have a lot of riveting things to say around today's topic.
Sure
Next, we have Tina from Baxter, Manager Global IT Quality Compliance. Tina, welcome to today's webinar.
Thank you.
And Tina has, she must be 29, she has 30 years of experience.
She started when she was one.
Validation, CAPA, document management, PLCs, laboratory instruments. So Tina, welcome to today's webinar.
Thank you.
And last but not least, our moderator today from Compliance Group, Mr. Khaled Nasali. He is our Executive Vice President for Client and Regulatory Relations. He has over 30 years of experience. He's also 29. That handles the gamut around CSA, CSV, validation, tons of experience in the med device and pharmaceutical industries. So without further ado, I will let Khaled kick it off as we talk about this riveting topic in today's CSA webinar.
Awesome. Thank you so much, Chris. And thank you, my colleagues and friends from the FICSA team. One fun fact about Tina Kepke. So Tina and I worked together at Baxter. So here's the fun fact, that she used to be my quality assurance when I was in IT. And let me tell you, she was a very tough lady there. Okay, she made my life miserable in terms of computer system validation, and therefore, when I left Baxter, then she reported to me. I made her life miserable. No, I'm just kidding. I did not. We definitely both worked together to streamline the computer system validation one way or another. Okay, now I'm outside of Baxter. She's still in Baxter, but thankfully, she's on the road on implementing CSA and doing a lot more stuff as well around computer system validation. So that's a fun fact. All right, FICSA team. I always like to present the slide to give the credit of this marvelous team that have worked tirelessly for the past 4+ years on coming up with a recommendation on how to streamline the computer system validation. So I guarantee you, in every organization, every CIO, VP of IT, whatever it is, financial, commercial, quality, etc., all IT vice president are screaming, please help me minimize the validation cost to my projects, right? And it's been, CSV has been hindering the IT, the innovation, in order for them to really move forward and actually come up with better solutions for us, because they're always thinking of that 40+% tax, which we call it tax, it's computer system validation, right? Well, it's not. But the idea of this team, FICSA team, work together with recommendation on how to streamline the validation process. And as a result of it, with the collaboration of Cisco Vicente from the FDA and Jason Spiegel from Siemens leading this effort, we're able to come up with a draft guidance that the FDA is working on. And I know most of you are going to ask, where is the FDA draft guidance today? Well, it's in the hand of the FDA attorneys, which is a good sign, right? Is it going to be released in fiscal year 2021? It might. The 4 of us on the FICSA team, we will not be able to answer that question. We will just tell you, yeah, they might, they may not. As far as I'm concerned, I'm moving forward. GAMP endorsed it, released quite a few guidance around CSA. And CSA is a strategy. So if you like to implement, that's fine, and collect the value. If you don't want to, you can wait. You can wait for another 25 years. But the idea is computer software assurance is the new trend, is what I'll show you later. It's the sexy label that GAMP5 has been talking about for so many years. So again, thanks to everyone on this team to help the industry. The next thing I want to talk about is the FDA view of automation. So the FDA, I heard it actually about 7 years ago, that the FDA were using box to store their own documentation. And look at us today. We are still afraid to actually store anything on box unless we validate box, right? So this is just a simple example that the FDA themselves are really pushing all of their centers to really move into automation, data solutions. They don't want to see crates of paper coming to their facility to, for example, to review a 510K for you, right? They want organizations to automate and move forward because the focus of the FDA is on patient safety, product quality, and data integrity. So that's really their concern and their focus. And therefore, this is what the FDA care about from a risk consideration. And actually, I can probably ask Ron, because I know Ron is kind of moving around a little bit now from the classic CSV because it's too boring for him. Now he's going into a new different direction. So I'd like him to share with us a little bit about risk consideration and what the FDA really care about. So Ron.
All right, so I'll do my best here. And just like I'll give quickly my disclaimer is that my opinions here on this forum are just my opinions. So I'm not necessarily here speaking on behalf of J&J, even though they are my employer and I use a lot of my opinions to drive the work that we do. But just again, we just want to start with that quick disclaimer that these are my opinions, my perspective on some of these things. So as we, again, as Khalid said, for the last 5 years, I had covered CSV. And so I think one thing for people to know is that with CSA, CSV is not going away, meaning like it's not CSA is replacing CSV. The CSV is still there. I will still do it. CSA is really about like some of the principles and like, again, a risk-based approach to the work that we do and applying good software development practices and keeping up with the times as technology keeps on changing. So just like staying abreast of what is going on. So as I move into my new role that has like more digital assets and some of the newer technology, like robotic process automation, again, not that new, but it's like one of those things that we do have quite a bit. And other topics, I think risk becomes, and a risk-based approach becomes really important because in some cases, we don't necessarily have a history. So compared to more traditional CSV, like in business process applications, it is more like bread and butter for an organization, like your ERP system or your LIMS or your MES. Some of these like technologies that are coming in, there is really not a lot of history. So you kind of like, you have to use a risk-based approach to decide, again, what is going to be your strategy for qualifying or validating. And I'm going to use the term sometimes interchangeably here, like qualify and validate. Mostly, again, going back to GAMP. GAMP usually tells you that business process applications should be validated, infrastructure should be qualified, but as you know, there is a lot of software these days in infrastructure to manage infrastructure. So, but again, I think intended use is usually like one of the key factors there is what is intended to do, and so that we don't treat sometimes infrastructure or a business process application as we would treat a product. So like again, this is not, and my team does work with software as a medical device as well. but kind of like knowing the difference, and I don't want to muddy the waters in trying to go into the product specific type of thing. So trying to stay on the non-product part of the software. But it's really, again, looking at the intended use, what is intended for, and then looking again, what's the impact that it has on patient safety, product quality, as well as data integrity. So even with new technologies, again, just there is not necessarily a lot of history there for us to mimic, like, or take approaches that we have done before, but keeping those things in mind, you can create a strategy that is, again, fit for purpose on what that application is going to do. So sorry for the long-winded answer.
This is beautiful. Thank you. This is great. Literally, you just summarized this. Again, it's risk is whatever direct impact to device quality, device safety, and also has a direct patient safety. To me, if we focus on the patient risk, everything is irrelevant at this point, right? Since we're on that slide, I'd like to go to Tina here and just give us a little bit, because remember, the topic today is risk-based approach and FMEA. Are they one and the same? So hopefully we'll get an answer at the end of this conversation. So Tina, your thoughts about risk.
Okay, and I'm going to mirror John to say, first of all, these are my opinions, not necessarily Baxter's opinion, and I could probably talk about risk for a long time, but for me, it really gets down to the guidance that they have here. Does it impact patient? And really, it's like, does it control a key quality attribute? So the way I've worked with teams to say, if a function would fail, would you do immediate recall? Or would that impact our ability to do a recall? That's kind of at a really high level of how to identify risk. And when you look at risk in FMEA, if you look at the FMEA, you've got, we evolve and train on that. And you've got the severity, the occurrence, and the detectability. But what I've found is the occurrence factor. So if you have a system that's globally used with a lot of people, that occurrence rate's going to be high. So that elevates your risk. So really with CSA is focus on that severity. The severity is really what's key. And then when you do your analysis, that's where you want to look at how you can design your detectability in. So that adds more value. Otherwise, you'll get stuck with this analysis paralysis, and really sometimes it might elevate the risk unneedingly. Take an example, training. We've always heard from the regulators, training is low risk, it's got indirect. Well, if you're deploying a global training system used by a large company, that occurrence can elevate that risk unneededly. So it's really about trying to focus where the risk is, and that's where we want to put our efforts, because we all want to protect the patients. We all know that our loved ones might be in the hospital. I can say right now, my nephew is in ICU right now. So, and we're relying on our quality system. So, let that be I call it our North Star, because we want to have not only anything that controls anything that's a key quality attribute, but also data integrity, because we want the people that are making those quality decisions to have all the information so they can do the good work that they always want to do.
Awesome. Thank you, Tina.
Mm-hmm.
And Annette, back to you. Kind of a very similar question about risk. What's your view of risk?
So to me, when we do computer system validation or computer system assurance, risk is the ultimate goal. Everything that we do is to minimize the risk to the patient. That's our ultimate goal. So my view is that it's risk should be integrated everywhere in the computer system or software validation process. Everything that you do, you should think about why you are doing that, right? And are we doing it so that we reduce the risk? If not, that's probably something that we should not be doing. That's the main goal. And that's always whenever my team, my customer asks my help to solve the software validation, whenever they run into issue, I use risk as the decision point to determine the course of action to help that. And so, you know, learning the CSA concept, it's just like right away I feel very passionate about, yes, this is the right thing. This is exactly what I've been working for. And so I'm glad that we are working on that, and really glad to be here to also promote that thought.
Awesome. So, Anik, I guess, you know, as we discuss, and by the way, I'm going to say a disclaimer about whatever Anik is going to say. His opinion is not Medtronic, okay? I can say whatever I want. But I want to make sure you are protected. But the question really I'm going to ask, so has Medtronic, or the organization that you report up to, have they moved away from the classic? The reason why I call it classic, because of this, right? To me, FMEA, and I've seen it forever, right? It's really one of the tools, right? FMEA is not the only tool, but it's one of the tools. And it's been used heavily in computer system validation. And obviously, and we have tons of examples. If my buddy Stephen Cook was here, he will express his hate to FMEA just because how many resources it takes, the time it takes, the money it takes, and at the end of the day, it's just an exercise to have documentation. That's it, right? And again, I don't want to speak for everyone, but I would like to really start with you, Anik. Has Medtronic or your team moved away from the FMEA to the CSA risk-based approach? And just give us an example of how did that happen, if it happens.
So actually, we have moved away for a very long time now. How that happened is kind of like about 10 years ago, actually, where we have this problem about, you know, our software validation process being very cumbersome. We have a lot of documents that people complain about it. So we want to, again, like I said earlier, you know, stick to the risk, right? Make sure that our process focus on addressing risk in a way that add values. So we organize, we write basically our process. And the way we approach risk, so understand that the FMEA and the approach that so FMEA or CSA, it's all, FMEA is also a risk management approach. It's just, you know, the level of details might not fit with the work that we do is computer system validation. And that's what the one thing that we change is how we do our risk analysis. And we use the ISO 14971 as our approach, which is an approach that instead of, unlike FMEA, where it starts at the process, by process, within your work or within a functionality within the IC system, the ISO 14971 start with the potential source of you know, the hazard. And so usually that isn't a lot. For example, like, you know, user mistake, maybe computer virus, hacker, that usually that's a limited things that can be the source of harm, right? So we start with that and we determine the harm, the severity that Tina mentioned, and so with that we focus on what can go, not what can go wrong, but how bad that system can have an impact to our patient, and we go from there. By being able to focus on the source of harm, we don't have to look at every single functionality within the system. We stay at a high level, and that's how we've been using that. And with the current thought on using CSA to even, you know, reduce the amount of testing documentation, that's when we use that severity, do a little bit more analysis, do a little bit more critical thinking, and allow that to guide the level of testing documentation that we do.
It's awesome. And actually, there's two kudos for you. You started 10 years ago, streamlining, before even CSA was born, So that's a beautiful thing. So thank you for that. All right, I'm gonna jump back to Ron. And Ron, kind of the same question. You know,
Sure.
has your organization, again, not the entire J&J, have they moved away from the classic ugly FMEA for computer system validation?
So I'll start with a saying which says, like, when the only tool that you have is a hammer, then everything looks like a nail, right?
Love it.
So, and don't take me wrong, there is a place for FMEA, but I think you need to keep in mind that FMEA is just a tool in the whole risk management program, right? So there is a place for it. I worked in manufacturing and also R&D for a number of years, and I think it is a really good tool for those processes. Personally, I don't think it is like the best tool when it comes to CSV or CSA. And I'll give you like a quick run through again my thinking process. So when you do FMEA, again, you need to keep in mind FMEA is not an exact science, right? It is more of an art than it is an exact science. So there is a lot of guessing that goes into the process, and probably if you go through 100 different companies, you're going to see 100 different ways that FMEA is done. Not that how it's done, but so a couple of things. So there are 3 components to an FMEA, like to start with. You need to define criteria for occurrence. So usually people have like a 3-point scale, 5-point scale, 9-point scale, and each manufacturer defines those differently, like what occurrence is. Same thing for severity. Again, you could be like 3, 5, 7, 10-point scale. You define that. Other companies might define it differently based on the kind of products they have. And they have also detection. So you define, so those are all 3 components that you need to define what they are. Then you also need to define what is an acceptable level of risk. Again, every manufacturer will define differently, but the manufacturer has to define that. Then you have, so when you actually then put together a cross-functional team, you go through each one of the hazards, and then you do all the ratings and all that, you end up with an RPN that it's either like above or below that threshold that you have established. Really what that tells you is, to me, it is something that maybe helps you, if you have limited resources, it helps you to prioritize where your resources will be placed so that you can reduce or eliminate a risk. But also, because it is not exact science, there is a lot of room for fudging. So people start tinkering with the numbers and scales and all that in order to maybe get a number that is below that RPN, so they don't need to do anything. And they say, oh, the benefit outweighs the risk. So with all of that guesswork that goes into it, there is a limited place for it. There is a use for it. But again, looking at the screen, you have like a risk-based testing approach. And to me, what we're starting to move is towards more like an end-to-end risk management approach. So it's not just about, okay, I have all my requirements for my software, now I'm going to test it, and how to do the testing, but really looking at all aspects of it, because again, software doesn't like run on its own. You have your infrastructure that is needed, and you have, again, it's not just about the patient safety and product quality, but you also need to consider things such as cybersecurity, about access controls, backup and restore. There is again the whole ITIL like framework that you have to keep in mind. And so think bigger. But I would say in most cases, again, if you have like an FMEA type of approach for testing, usually you go through that whole exercise. But guess what? I would say most companies at the end of the day, they end up testing everything, right? Because you have your requirements, you want to demonstrate that requirements were tested or verified at some point in time during that development. So the thing is, like, why would you go through the exercise of actually creating an FMEA and all the pains and things that go on to create that? If you're going to test everything, just test everything. Make sure you do a thorough job with that, and then look at the end-to-end. What are some of the other risks that you have in the process, and then look for ways to mitigating or reducing that. But without necessarily trying to, again, fit it to a scale and what is like an acceptable RPN, and it's more about like, what is the appetite for risk that the business has? Can you mitigate? Sometimes you can. There is like, essentially, if you're buying some like off-the-shelf software that is the only thing in town and it doesn't have the controls that you need, well, sometimes you just need to accept the risk and go from there. So I know it was like a long-winded answer, but to me, there is a place for FMEA, but think in terms of like risk management programs, so go a little bit broader, because again, there is a place for the tool, but I think many times in software development, it might just be the wrong tool for the job. So just don't do it. Again, I think this is where the CSA comes in. Question everything. Is this the best tool for the job? And sometimes the answer is no, because you already are testing everything. So why go through the effort of doing an FMEA? So for testing, right? So let me stop here and give an opportunity for the others to express their opinions as well.
And I talk too much, huh? No, that's okay.
Oh no, like between you and I, we can talk for like the whole.
Actually, if Ken Shimoda was here, he would have covered all of us. Okay,
and,
go ahead.
I can go on with Ron, and I agree. There is a use for it, but it's like within that process. So let's say your quality system or your process also has an FMEA within that manufacturing process or whatever process. Well, CSA is only automating that process. So, you know, like the computer system is automating it. So it's not really adding any additional risk. It's automating it. So leverage that risk that's already been performed within that process, if there is already a process risk assessment. And then, as Ron said, you've got that innate on that infrastructure layer, but data integrity already gives us that guidance. You know, look at your user account, look at your backup and restore. So it's already kind of given us that framework around that data integrity risk and that guidance on how to mitigate some of that.
Automation is a way of making defects faster.
Correct. Exactly.
So you guys are already answering the question. If FMEA is and risk-based approach is the same, you guys are making it boring. I want you to fight a little bit, but this is not happening. But I'll pick something for you to fight.
We are in violent agreement.
And this is 3 giant organizations here, but that's okay. That's good. So obviously, you're really recommending to the industry for computer system validation. Don't exhaust yourself. Don't go through the entire FMEA process just for the sake of it. Find a better way to do it, whatever that better way to do it. Don't call it CSA. Call it HIK. I don't know what you want to call it, but just move on and apply something different. So this is great. Now, I want to go back to Anek a little bit. So I know Anek, Medtronic, or that specific organization, kind of transitioned to CSA and they went into automation. What was, I guess, your first impression when you saw CSA coming at you and you saw the very first overview of CSA? Was it like an eye-opener? Was it, oh my God, this is a strange thing to do? And the reason why I'm asking you, because you recently joined the FICSA team, and I'm glad you did. And by the way, I'm going to give you a little bit of marketing here. So Anek is behind the myth and facts that we've been posting on our FICSA LinkedIn. So thank you for that idea. This has been great and gaining a lot of attention. So back to the question.
Thank you, Khaled. So my first impression when I heard this idea, it was from Cisco presentation, and I was like, wow, I love it. How fast can I implement that? That's my first impression. And so, you know, just a little bit of, you know, how do I take that from there? Right, I right away, I love that. And at the time, during that conference, there was another company. I don't know if you remember, Frank. He present, you know, how his company implemented, right? And so I reached right away. Yeah,
that was so light fast.
Yeah, and I reached out to him right away, trying to learn from him. You know, how did you do that? right? And basically, I then come back and think about how do we fit that? How do we make it a language that everyone at Medtronic Global IT can understand? And then I start from selling that idea to our management, get their support, which they are all very supportive. And we kind of go from there. Once we have the support, we know how to translate that. We do translate that into our language that's easy for everyone to understand. And at the moment, we are in a position where we don't force them on everyone. We just let people talk about it. As more people realize the benefit from it, more people come to me, and I help everyone one by one to implement CSA.
And Tina, really kind of the same question. I know you're slowly but surely moving along with CSA. How is the adoption? How is the resistance to CSA and to the CSA risk-based approach specifically moving? Because I know back in my good old days, FMEA was the beautiful stacks and stacks of paper, but I know this has been shrinking a little bit. So I mean, how are things going in your neighborhood?
Yeah, I think it's, again, communicating that with, where is that benefit? Some people they like their FMEA, they can't get rid of it because they want it measured a certain way, even though it's very subjective. Like a NOC, we've kind of started with, piloting lower risk systems and showing that benefit. So that's kind of how we've been approaching it. And then also, as a company, updating our tools around CSV to allow that. So that's kind of where we are in the journey. And it seems like as you have one success story and it's shared with another one, and then it's shared with another one. And then also at the end of any pilot, it's discussions of lessons learned. And what can we do better? How can we make it clearer? How can we give additional, so we could, because there's kind of guardrails around it. And whenever anybody's talking about risk, it's you can put two people in doing the same risk assessment. And I've seen one person will say this is high and one person will say it's low. So how can you try to bring some guidance for a little bit of that interpretation throughout the process? So it's a journey. We start with pieces and then just keep building on it.
Got it. On that note, actually, I want to ask Ron. Ron, are you able to share any anecdotal savings, percentages, dollar sign? I don't want to say head count because there is a total misconception that CSA is going to reduce head count for some organization. And for those of you listening, no, it's not about head count elimination or transformation, right? It's about right sizing the validation for your system. Okay. So Ron, any anecdotal information that you could share with us?
I think if people want to see, maybe like we actually did a pilot. So this is like almost like 2 years ago when we first talking about CSA. So we actually did a pilot, and there is actually one of the webinars of the series. I think it might have been like episode 4 or 5. So people can just like look at the archives where there is more information about, again, where there were some savings. I don't necessarily have a dollar amount, but even if I did, I don't think it will be appropriate here to do that. But it's more about time savings in gaining efficiency. So using like agile speak, you really your benefit, even if if you don't necessarily want to get to like a specific dollar amount, it's more about the velocity that you gain. It's being able to do things and best utilize the resources that you have, and so that way you can make changes. You can make changes fast. You can add functionality that is really useful to your users, your customers, and so it's really about velocity. So it's a similar conversation that you would have with like when people are switching from waterfall to agile and thinking that suddenly like you're gonna save X number of dollars. Well, your potential for savings is there with agile, and same thing with CSA, is because you're able to quickly pivot and make adjustments, or to really be rational about where you put your effort. And so you're putting more effort into designing, essentially building something that is really good and it works, versus putting a lot of effort in testing at the very end and then creating piles and piles of documentation that it doesn't translate into having a good application that works and it does what is intended to do. So really, like, I think the focus should be, again, definitely not on headcount. You might, again, over time see a benefit, but I would focus more on the velocity that you gain from, again, being able to better utilize the resources that you have. And if you want to see details, then just look for that webinar. So like from like, I think it was like last season. So there, like in
season 1, yes. It will be on Netflix.
A great job in, again, presenting what we had done. So that's, again, that you will be able to see some of the changes, again, how we started this process, how we started the journey.
Got it. I guess from an implementation challenges, right? And this question to any of you, did you encounter any of the challenges as you were trying to implement CSA? Because again, you were the kind of the champion, really bringing in the CSA idea to your organization. What was the very first thing about, and I'm sure there's a lot of other things, but what was the very first thing? The challenges, the pushback, the resistance that you received either from IT or quality, or could be business. Tina?
There's a number of them. Some of the challenges are people, like, they love their documents because it's been so ingrained in us. If it's not documented, it didn't happen. And we got so used to having screen prints, because that way we have that screen print when it comes to testing to say, okay, you know, especially if I'm a quality person, I could see that screen print. So it's that assurance that they have to let go of that. And the way, you know, I've overcome that is you take a step back and say, okay, you have a tester that gets a screen print, then you get a verifier that verifies that screen print. So we have a 200% verification. So why are we doing a 200% verification on something that's low risk that really has nothing to do with you know, key to quality? So why are we doing this? You know, so that's one. And another one that, in the way I've, you know, communicated this even on the business side and the quality side, as I go, it really gives its overall framework. And what's key with CSA, especially when you get the risk-based testing, is that ad hoc testing. And I equate it to, I call it a day in the life testing. So, you know, your end users are going to find something odd in that system. They're going to do something that, no matter how detailed you do your FMEA, you're not going to think of that scenario. So if you give them the direct procedures, if you train them on the system and let them work in that test environment, they're going to do something weird, and they're actually going to find the issue so you can address it, you know, before it's in wide use. So it's actually a very valuable tool. And even if the system works, they might get feedback on their procedure or their training materials. So that's been a win for our organization, where it comes to some of the people that might be a little resistant to say, hey, wow, yeah, it gives us valuable feedback all along the way. And like Ron says, it's more about speed to get the functionality out there for use.
That's great. I guess, Anek, did you experience any of those kind of challenges, similar, different, any different ones?
Yeah, so there's a lot variety of challenges. The very first one, I did cover that a little bit earlier, is how do we implement it, right? So you heard all these ideas, but actually how to translate into your process, how to find a pace in your process that works. So that's the very first. But I want to touch on what everyone just talked about a little bit on the benefits. So there is the challenge where, you know, once we have the process, we have to convince the system, the people that own the validation to adopt this new idea, right? Which is very, very different from what they are comfortable. So the one thing that I usually do, at the beginning of my meeting with everyone is to make sure they understand this is not an approach to reduce costs. This is an approach to allow us to spend our time focus on more testing, less documentation. That's the very main idea. And once I get that message across, usually, and you know, the most difficult people to convince is internal auditor. and so, you know, as I explained that this is actually going to increase our, you know, improve the way we can assure that the system works. I was able to do that. And once I get our internal auditor to buy into it, I think I can get anyone to buy into it.
Ron?
Yeah, I think similar challenges there, but I think with CSA, I think a couple of things. One is we need to remember, like, CSV is not going away. So it's not that this is like something new. Another aspect of it is a lot of the principles that are being promoted through CSA, they are in GAMP 5, right? So if you're familiar with GAMP 5, a lot of the stuff that we're talking here, it's there, it's scattered into like a few places. So again, if you have read the whole, again, big honking book, you will see that, again, what we're talking about, it's there. It's just like it's scattered into different places. So a lot of what this is just kind of like bringing together some common sense, and I know common sense is not common practice, but common sense practices, bringing it all together and basically saying, look, again, we are allowed to do some of these things. Like, why aren't we doing that? But the other thing is we are challenging assumptions and practices that have been in place for almost 40 years. Again, looking at like when the last time the GMPs for pharma changes, like I think it was like 1976 or something like that. Don't quote me on the exact date, but it has been there for a while. So we have a lot of practices that have been ingrained, and this is how we have operated for the longest time. So when someone comes along, particularly, I would say it is challenging for those that are in compliance or in quality. Is like, these are like, again, like well-established practices. We know that if we do these things, we're going to be okay. But it is just one of those things you need to look at, like, well, is this what we want to do going forward? So similar to what Tina said, we just use the term like screenshots, but essentially that has been like the practice forever of just like essentially having a screenshot for every script. It also, like, again, for the longest time, everything is robust scripting, so like very detailed script. The thing is, robust scripting many times fails to identify issues because it is so detailed, and you follow that script and that essentially works. But in real life is like you have real human beings in front of that computer, and then they say, it's like, what happens if I click over here? Or what happens if I try to delete this thing, right? Sometimes you cannot think of all possible scenarios when creating scripts. So again, CSA is promoting, I know, like, for me, as like English as a second language, we use the term unscripted testing. And so in the FICSA team, we talk about the CSA manglers, right? Or the people that are out there and they're doing all kinds of crazy stuff, and then they do it in the name of CSA.
Yeah.
So then it gets other people to think is like, oh, CSA is non-compliant, essentially, like we shouldn't be doing this. Right. Like, you have to be able to separate the manglers from those that essentially really are doing these things on a risk-based approach. But so there are challenges, but I think the key is, like, sometimes you need to use the logic. Like Tina was saying, like, why are we checking something like 200%, 300%?
Yeah.
Essentially, if our controls are not good, then essentially anything above like 100% are like, we shouldn't be doing it, and we should be questioning what we're doing. And the thing with software is the best way to find defects is with more testing. So CSA is not advocating to do less testing, but it is advocating to do more testing or to leverage testing that already has been done. But go light on the documentation. So I personally, instead of using the term unscripted testing, I prefer to use a term that is like it's actually I had read like limited scripted, because you still have a script, but it's just very limited. It's not a step-by-step, click-by-click, but it is still, it tells you what you want to do, what you want to accomplish. How do you know that you were successful?
Yeah.
But you'll still need something like that. And I think again, sometimes people take like terms like unscripted testing and then run with it and say, oh, this is non-compliant and there is nothing, and it's not the case. So I know it is like it's part of the vernacular of software development, but I think for us in the regulated business, maybe is using limited scripting instead of unscripted. It is a better representation of what we intend to do. So there will be challenges, but I think you need to basically tackle one at a time and be able to show the value. And sometimes you do test and learn, where you do a little bit and show that yes, it does work, and then people get a sense that yes, this thing can work, and so then you do a little bit more. So it's not going to be like overnight you're just going to revolutionize this, because you have 40 years of history to overcome. So baby steps, like smaller steps, and you'll be able to demonstrate that there is value. And in doing so, also people can contribute in like asking questions like in other ways that you can make improvements to your process. So it's not that you have all the answers to everything.
Absolutely.
So let me pause here. Otherwise, I'll steal all the time. So
you got it. That's fine. And just to your note on unscripted, and I know we wrote a myth versus facts, that unscripted, it's not undocumented. So it's really important, and that's really where what the CSA risk is driving. It's helping you to actually evaluate what is really high risk, right? Focusing on patient, product, and data integrity is to allow you to leverage this unscripted or the ad hoc or the limited scripting, as Ron said. And to your point, Ron, just like you said, this is directly from the risk management process in GAM5. I mean, literally, it's step by step. It talks about what we have in the CSA. I don't want to say the CSA guidance, but in the CSA recommendation. And most of you will see the same thing in the CSA appendix and the GPG data integrity by design. And I always make the joke, the only thing was missing in GAM5 was the 3 letters CSA, because for some reason, CSA, computer software assurance, is putting a spotlight on GAM5. GAM has been discussing this, has been talking about it. Look at this, the evaluation of the risk to quality should be based on scientific knowledge and ultimately linked to the protection of the patient. So again, the focus is on patient, right? The level of effort, formality, and documentation of the quality risk management should be commensurate with the level of risk. So talking about risk and moving away from the documentation practice that we've been doing, we're not saying, again, to Ron's, FMEA is a good tool, but kind of leave it for the product, right? Leave it for a product and focus on something different. If you don't want to use CSA, use something different. I'm not going to tell you what that is, but again, it's all about critical thinking, right? I know we're coming up on 10 minutes and we see some questions. I'm gonna give each of you here a final word before we jump into questions, or would you like me to go into questions first?
Questions.
Questions. I know you
for
like.
me, I'll leave the other speakers if they have any parting words.
Okay. Questions sounds good. Okay, I see a couple of good questions here that came. Come on. Where are you? Okay. From Rajesh, how does CSA define the testing approach based on FMEA? That's actually will be kind of in the slide deck. really that will help you when we share this with you. It kind of walk you through this, the computer software assurance, from intended use to identifying risk to the activities and to the record. Is anyone else would like to add to that question? How does CSA define and testing approach based on FMEA?
I would say CSA, it starts at the top. So start at the top, what's the overall risk? And then identify those functions that have high risk. So instead of doing, an analysis paralysis of every single function, start at the top and identify where that risk is. And I think that's the difference with that CSA approach when it comes to risk.
Okay. Another question, did the CSA implementation within your organization happen with a pilot? How did you measure the effectiveness when compared with the earlier CSV approach? Anybody?
So I can speak to that one because we actually did a pilot, and so part of what we were trying to do with the pilot was to basically show that there was, by doing what we were proposing, that we were not taking unnecessary risk or creating, again, situations where we would be like non-compliant. So a lot of what we did was, like, again, with our first pilot, believe it or not, is essentially we were executing on practices, given the size of our organization, that we were already doing in some other places. So it was like there was not like an unnecessary level of risk being taken, but just bringing a lot of good things together. So, for example, you will see in that webinar where we moved from waterfall to agile. So there were, again, some velocity that we gained by doing that. We were using it was a global program with local deployment. So we had done a lot of the baseline qualification or validation for the software in multiple pre-existing deployments. So the question was like, why do we need to keep on repeating this? Because we already did it like 2 or 3 times. It's like essentially the same result. Can we leverage that? So leveraging that, leveraging work that was done by the vendor and working with the vendor as a partner to really focus again, what is different, like essentially where are they like at the highest risk? And so doing that. Also using limited scripting. So I'm not going to say the unscripted here, but limited scripted testing. And why that worked? Well, it worked because the people doing the testing and really involving the users to do some of that testing, because then it was really reflective of, is this going to work for them at the end of the day? But number 2 is, how can we do limited scripting, is because they knew the application very well. So they can go and do it like with minimal instruction. So it didn't require, like, again, deep instruction. And really involved in many cases, again, is like just like you would do in an FMEA, you have a cross-functional team. Again, in applying CSAs, you also need, it's a team effort. So you need to sometimes, we in quality and compliance, we don't necessarily have all the answers. And so many times people will say, well, what if we did this instead of that? Essentially, can we do it? And so you just need to be open to the idea that, again, just because we did certain things in a certain way, is there like a better way of doing it? Or again, understanding what is being proposed and say, yes, like, again, I covered that risk or I covered that testing elsewhere. Do I need to repeat it here? No. So again, you leverage or you can cover that. So to me, again, with pilot, again, it's like, it's the best thing is just, again, do like a small test and learn, and then you keep on evolving from there. And then over time, you find other opportunities where you can still like simplify it and increase that velocity.
Thank you, Ron. Another question coming from Eshra. What is the difference between risk-based thinking, which is ISO 9000-2015, and risk-based approach, ISO 13485-2016? To me, it's go ahead.
No, so I'm not familiar with the first 1 or 2 that you mentioned. So I could only say that the difference between FMEA and the ISO 14971, right, is the FMEA is again about the functionality of the software, and you basically don't start with the risk. You start with the functionality, and you assume that if they failed, you kind of then do an analysis on how do you detect those failures, how do you control, how do you mitigate those failures, right? Which is a lot of work for a complex system. But ISO 14971 start with, like I said, the high level, like Tina said, what's like the severity that could happen to this type of system with this intended use. And that's allow you to focus your effort at the right place, at the right level.
Yep. Okay. And we have 1 minute left. I guess what additional measures shall be taken if organization is choosing cloud PaaS services? I think Ron might have the answer. What additional measures shall be taken if organization is choosing cloud services?
Well, I think, again, if you are doing like traditional CSV, and like, again, where you develop the application in-house, so it could be custom or it could be configured. The thing, again, when you're working with again, cloud-based solution or software as a service, kind of like you need to take another look at what your CSV practices are. So things that maybe you did before may not apply here. So it's kind of like you need to look at, similar to, again, if you're doing like CI/CD type of development or software as a service, you may not necessarily do CSV the same way. Like, and you don't want to sometimes affect the velocity of the development because of your practices are not keeping up with the technology. So, again, cloud-based, obviously you need to make sure things still like work as intended for you. So are you worrying about doing like system testing? Probably not. Again, leverage what the vendor has done for you. But you need to worry about things like, for example, like what if the application is not available? Like how you're going to mitigate that. Definitely like in privacy and security and data integrity. So those are things that like you need to keep an eye on. Vendor selection is key, how much you can leverage from the vendor, but at having that partnership with the vendor. And obviously, depending on the size of your company, they will not even tell you the time of the day. So you, like, to me, big focus is what is it that it is within your control, and then making sure that those things work and the application works for you. And then leaving some of the things for the vendor and let them worry about.
Thank you, Ron.
As Ron said, also it's vendor and vendor selection is key. So, if they, take a look at what certifications they have, if they, allow a supplier audit, look at their software development practices and look at how they're managing that, because they're managing that part of it for you. So that's key. Take a look at your contracts, because that's another thing so it's a lot about the vendor, and then knowing what controls they have, then what additional controls you might have to do at your own company.
And by the way, thank you for that question, because as we all know, everything is moving to the cloud, right? Whether it's infrastructure or software. I think, and probably Tina, I'll just remind you that certain organizations should have a CAPA process in place, specifically when they have data losses in their validation environment, where you lose all your testing and stuff, right? So again, yes, it's all about the vendor, and make sure the vendor is responsible. But guess what? At the end of the day, you as a manufacturer is accountable. You are being audited by regulatory agencies and not your vendor. So it is so important to choose the right vendor for the right tool. I think we're definitely at time, and I wanted to thank you very much, colleagues, Ron, Anik, and Tina. I appreciate it. I know there will be follow-up questions, and I'll be reaching out for you because I see some additional questions came in. But thank you. Thank you again very much.
Thank you very much, everyone. Enjoy the rest of your day, and we'll chat soon. Thank the panelists. Thank you again, and we'll chat with each of you soon. Thank you.
Take care. Bye-bye.
Bye.
Bye.